Angels Care Home Health, serving Hayes and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
I would recommend Angel Care to anybody. They have really helped me regain my strength.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible. Angels Care Home Health. We serve patients.
I couldn't have survived this without Angels Care.
Eagle Community Television presents Community Connection with your host, Mike Cooper.
Hello and welcome again to Community Connection from Eagle Community Television. Thanks for watching, and thanks to our producer, Jeff Durall. We are at Stroop Hall on the campus of Fort Hays State University, the Department of Nursing, and Dr. Jenny Manry, Associate Professor of Nursing at Fort Hays State, as we talk about the nursing program. Dr. Manry, first of all, congratulations to you, to the faculty, and to the students for the Nurse Practitioner's exam. We had word, and this is one of the reasons we set up this interview with you, the 24 graduates who recently took the American Academy of Nurse Practitioners certification exam had a 100% pass rate on the first attempt. That's an outstanding tribute to the program, Dr. Manry.
Yes, we're very excited about our graduates and the success that they've had on the test, and the recognition that gives to their hard work and how well they did.
Stroop Hall, the Department of Nursing at Fort Hays State, has always been a kind of a quiet department, if you will, but always in the forefront of quality.
That's right. We've had success with our undergraduate program on campus. We've had very high marks this past year with students passing the NCLEX, and we have a very strong RN to BSN program. And then our nurse practitioner program is just second to none.
This program itself goes back a long way in the history of Fort Hays State, doesn't it?
It does. We've had a program since the early 90s, and my colleague Dorothy Oakes has taught in it, and we teach with a consortium out of KU in Pittsburgh and are in a collaboration with them and have a very strong program.
Tell us about job options that are available. We always like to find out what the young people who are going to be graduating in the nursing program, what are their options in the way of jobs, Dr. Manry?
Well, we have our traditional graduates with their BSN, and they commonly go and work in the hospital setting, in the ICU or in the ER, medical surgical floors. And then my program, which is the nurse practitioner program, we have nurse practitioners that are going all over Kansas, especially in our rural areas, and working in family practices alongside physicians and taking care of patients as they come in with acute and chronic illnesses.
Okay, let's go to the BSN program. BSN, what does that stand for?
Bachelor's degree in nursing.
All right, and they can go then directly into a hospital setting then?
Yes, these are your nurses that care for your patients on the floor, and they can go right in and care for patients once they've passed their NCLEX exam.
Now, what about the nurse practitioner program of which you're a part? Tell us about how that works.
So someone that wants to enter the nurse practitioner program needs to have 1 year of RN experience, so working in a hospital setting or a clinic or a nursing home, and then they can enter our program. Currently our program is 51 hours of a master's degree, and after they have completed 51 hours they can go out and practice with protocols that a physician has signed and set up with them, and they can practice and prescribe medications to patients. We're in the process of transitioning to a doctoral degree program. We are the only program in the state of Kansas at this point in time that has not transitioned to a doctoral degree program, so we are in the process of requesting to the Board of Regents that our program transition from a master's level program to a doctoral degree program.
And part of that has already taken place, hasn't it, with your site evaluation?
Yes, we had our site evaluation this last week. Thank you for mentioning that. We had 3 site visitors from all over the country come and spend 3 days with our president, our provost, the deans, and going through our program. And on Friday they announced that they would be making a unanimous recommendation to the Board of Regents to approve our program here at Fort Hays. That approval has several more stages to go through, but will hit the Board of Regents' desk in June. So we're excited to see that happen.
Give us just a brief idea, if you would, Dr. Manry, of what the site evaluation team looks for. What's the program? What are the standout parts of the program they want to know about?
They're looking at our syllabi for the new program. A doctoral degree program will go from 51 hours to 72 hours. They're looking to see, are we incorporating our essentials from our accrediting body? Are we incorporating into those syllabi what we should be incorporating? And then are we evaluating our outcomes? How do we know that our program is successful, and do we have an evaluation process in place to evaluate the program itself?
And the syllabus, for those who aren't in the education field, really is what you want the students to know.
Sure, each course kind of a mini template of what is going to occur in the class throughout the semester and what the students will achieve by the time they've completed the course.
As a husband of an educator, I've heard the word syllabus a lot over the years. So this ruling by the Kansas Board of Regents site evaluation has already given a unanimous recommendation to approve the doctoral program. When would be the time frame on this? Do you have any idea?
Right now we're looking to accept our first class in spring of 2016 and hopefully hold classes summer of 2016 to begin that process, of course pending the approval by the Board of Regents.
What would a doctoral degree mean for a graduate then?
The difference between a doctoral degree and a master's degree is really the number of clinical hours that the student has. Across the United States, the minimum number of clinical hours a student can have is 500 clinical hours going out and practicing what they're going to be doing. And with a master's level, or with a doctoral level, it will be 1,000 hours. With that, they learn leadership qualities and significant more textbook theory before they get out into practice. The main reason we at Fort Hays are interested in this is we're producing a lot of nurse practitioners that are going out to rural Kansas, working in ERs, working in family practices, where they may be the only provider in those areas for weeks at a time, and therefore the additional clinical hours is very valuable to someone who isn't going to have that physician support all the time.
Boy, it would just broaden the base of their knowledge tremendously then, wouldn't it?
Most definitely.
And this is so important, I think, about the nursing profession. Several years ago, we went through a transition period where we heard that there were so many vacancies in the nursing program. What's that current situation, Dr. Manry?
In the
statewide,
yes.
in areas of hospitals needing nurses, basically.
I think we still see that in nurse practitioners. I think we've seen a decline of physicians wanting to go to rural areas. So I think we have a strong demand for nurse practitioners. I commonly get physicians and hospitals from across Kansas calling and begging, do you just have a graduate that would consider coming here? As far as nursing in general, Kansas is a state that we still have occupancy for our nurses when they get out. We do not have nurses that struggle to find a job. So
it would seem to me, Dr. Manry, that attracting so many students to a university like Fort Hays State, basically in a rural area, that many of these young graduates would want to stay in those rural areas to be able to help those that they may have grown up with, or certainly in those kind of communities.
Sure, I think we have several students that may come from Wichita or Kansas City, and maybe their family lives in Colby or in Goodland. They feel like initially they're going to go back to those areas, but then once they've gone and done clinicals in a hometown or in a town where they've had a physician and a hospital staff that has been very welcoming, a lot of times we will see students transition to a rural area.
So bottom line is, if you would like to have an almost secure job at graduation, you could enter the field of nursing.
Oh, most definitely.
Talk about, we were talking about the quality of the program, and we did want to highlight one of the faculty, Kathleen Ward, who was Fall Outstanding Teacher Award at the Fall Convocation at Fort Hays State, kind of a reflection on the quality of the program, again, of nursing at Fort Hays State. Tell us about your personal story, Dr. Manry. How'd you get into the nursing teaching area?
Well, I graduated with my undergraduate, my BSN from Fort Hays, and proceeded on to get my nurse practitioner. I worked out in a clinic for several years and eventually had a clinic that was going through a transition period and just felt like maybe I needed something different. My colleague Dorothy Oakes at the time suggested that I try Fort Hays, and I proceeded to find a good combination. I have a practice at Larned where I get to do a part-time practice. All of our nurse practitioners, it's a national mandate that if you work in a nurse practitioner program, you have to keep up clinical hours. So I get to have my clinical hours a few hours a week, and then get to work at Fort Hays. And often tell my patients I get to have my cake and eat it too. It's an excellent setup.
Well, it's kind of a combination, isn't it, where you can do teaching, but you're also doing actual hands-on work, if you will.
Most definitely. I think it makes our program and our faculty so much stronger when they are actively doing what we're teaching in the textbooks. So,
I want to say a personal note here that we really appreciate Dr. Manry's work here, because she came on what was normally a day when she would not be in the office. She left a sick child at home. She drove from Larned. She brought her expertise to tell us about the nursing program. So I do want to say thank you very much as a busy mom and a busy practitioner as well.
thank you.
Talk about your journey to Fort Hays State a little bit more.
Well, at the time I had young children and started out part-time at Fort Hays, and after 1 year I realized that this was a good fit for me. I felt like I was understanding the teaching role a little bit more. I had a very good mentor in Dorothy Oakes, and just slowly over the last few years have learned more and more about teaching, and have been able to hopefully impart that to the students.
We have a couple of minutes left, Dr. Manry. Are there other programs in nursing at Fort Hays State you'd like to highlight?
We have our BSN program that is very popular with students that are entering an undergraduate field. If they are unfamiliar with nursing, we have our Nightingale project, which takes place in the summer. Students can come from high school and spend time on campus learning what a nurse actually does. It's of course named after Florence Nightingale. So a good opportunity for students to learn if they want to be a nurse. We also have our program where students, if they're not sure if nursing is for them, they can come and learn a little bit more their freshman year as to whether nursing is the right choice for them.
So in the Nightingale program during the summer, or in a beginning program, if you will, they can kind of get a feel, a taste of what the overall program would be then.
Yes, yeah, an introductory nursing course that kind of helps them decide if nursing's for them. So.
Well, we want to give a special tribute to Dorothy Oakes, your mentor as well, who joined us today for the Community Connection program, and we want to once again say congratulations to you and the nursing program, the faculty, the staff, and the students who have to deliver the quality as well in the nursing program. From Stru Paul on the campus of Fort Hays State University, Dr. Jenny Manry, Associate Professor of Nursing at Fort Hays State, our Community Connection. Thanks for watching.
Angels Care Home Health, serving Hays and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
There's not any words to describe their kindness.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible. Angels Care Home Health. We serve patients.
They saved my life.